Hello and welcome to EC3 Hosa Medical Moments. I'm Gina Ryan, Director of Hardin County Educational and Community Television, and on today's episode we are featuring many of our outstanding health science career pathway students. They're currently enrolled in classes at EC3 in a large number of health career possibilities. And so these students have been working diligently on presenting the information about their pathway, about their career opportunities to individuals, somewhat in a fair type of format, like a job fair. So we hope you get a lot of information from these students and their instructors as they continue in their goal of achieving their career pathway in health sciences.
Hello, my name is Megan O'Daniel, and I am one of the health sciences instructors at EC3. I teach pharmacy, phlebotomy, and EKG technician. All those are certification pathways through a national exam. And for a couple years now, I've been working on a capstone project. There's been a huge push in project-based learning throughout the nation, and more schools are going toward that type of learning. So 2 years ago in 2020, I began these projects in a dream that we could present these to the district and kind of have like a fair, but then COVID hit and we were not allowed to do this kind of setup. So things have been kind of rocky getting to this point, but so far I think I've been very proud of what the students have accomplished and the fact that we were able to do this year. And these capstone projects are very well turned out. They are a nice review right before they take their exam, because reviewing all that material just is not particularly fun. But this is a way that they can be creative, and hopefully things that they forgotten at the beginning of the trimester now has finally sunk in.
And these are the laws that come with it. All right, thank you.
So tell us a fun fact. Do you have a fun fact?
Yes. Hippocrates is the one that he basically founded most of the medical groups around, including pharmacy, one of them. And he also was one of the first people to associate good hygiene with good health. And he also founded the four Qs, which is blood, yellow bile, black bile, and they equal air, water, fire, and metal.
Awesome. Thank you for doing this. Looks good. Good job.
Hello there, and can I get each and every one of you guys' names?
Hi, I'm Elena.
My name's Talina.
My name's Julie.
My name's Chloe, and we're the health science pathway.
All right. And so what type of project are you guys working on? Or at least what did you work on?
Our project's for EKG, which stands for electrocardiogram, and it measures the rhythm of your heart, like shows how your heart's beating.
So what if your heart was beating too fast?
That would be called tachycardia, which means it's like up to 200 beats per minute.
Oh. Okay, so would that be a good thing or a bad thing?
Well, actually, no. It depends on what type of tachycardia, because sinus tachycardia is just a normal rhythm, but it's very fast. But there's other things like VTAC, which is fatal.
Oh. Okay, but what if your heart was beating too slow too as well?
That's bradycardia, and it's under 100 beats per minute, or under 60. My bad.
And so that would also be fatal. Yeah. Okay. I really love what you guys do over here. Huh?
With all the parts labeled.
So what does this mean right here? What does all of this mean right here?
That is a model of an EKG where you would place the leads and the electrodes to actually record the EKG.
Okay. So, can you read me one? Can one of you guys read me one of these so I can understand a little bit more?
I'll just open the first one. And it says accreditation and certification. That's what we have to do at the end of the course. We have to have at least exam average of 78 to take the test, and it's what allows us to work in hospitals if we pass it.
Okay, career pass. All right.
The 12-lead EKG, it consists of 10 electrodes that work together to get 12 different views of the heart. So that's what the EKG actually is. These are an example of the electrodes that are used, and then this is an example of an EKG.
Okay. All right. Well, that's kind of all I have for you.
Thank you.
You're welcome.
Your names? Mackenzie Miller.
Jackson Abel.
Reagan Donovan. Rachel Tanner. So what is a pharmacy?
Good question. Well, pharmacy is a 2-trimester course. Pharmacy is a lot, really. It's a lot of information. This right here is just a fraction of what we learn. This is only, really only just the history learned about pharmacy. We learn a lot more about pharmacy, including med math, because it's a 2-trimester course that's thrown into one. So that's about much about the class.
But pretty much what a pharmacy is a place that is on very high lockdown just because of all the medication that's in there. And it is a place where medication is dispensed to patients who need it, and at the right dosage, at the right time, with the right medication. There's different kinds of pharmacies. There's community and institutional pharmacies. So community, you're dealing hands-on with that patient, while institutional, you're in a hospital setting, and your customers are nurses because they are the ones who administrate the medication.
How has the pharmacies and medication, changed over time?
Okay, so in ancient pharmacy, they would use more of herbal mixtures and just stuff that they thought would heal your wound. They would put, right here it says, they would put juice from a succulent leaf onto the wound that they thought would heal it. But now, since medication has advanced and evolved and stuff, we now have we now know ways to be able to put that kind of stuff into people's bodies and in controlled manners and all that kind of stuff.
So why are there so many laws with pharmacies?
Our poster only has about 10 laws, but there's actually 50 laws, and there are so many because medication is a very controversial thing to deal with because of how you can overdose, how you can not take enough, how it affects your body, and so they have to very strictly mandate it so that it's not misused.
And it's safe. It's safe for everyone to use, and you don't give them because you can mess up and give someone too much, and that could kill a patient, and so you don't want that. That's why there's so many, and that's why they're so strict.
Safety administration is probably the biggest thing that you have to watch out for because one extra pill could cost somebody their life. So the amount of times you count medication, the amount of times you check the dosage that pill bottle has before you put it in the prescription bottle is the biggest thing.
So what are the different types of pharmacies?
There's the community pharmacy, which is your local Walgreens and just CVS, stuff like that. There's an institutional pharmacy, which is in a hospital where they would give you medication if you're admitted to the hospital or stuff like that. And
there's also telepharmacy. You can do telepharmacy. You call and it gives you stuff through the mail. There's mail pharmacy. Nursing homes use the mail stuff, mail orders. They come in bulk. I worked at a nursing home for a little bit. We would have pharmacy vans come by, and they would deliver these huge just med packs of pills for the patients. And so there's all kinds of different ways for pharmacy. I'm trying to think how many there is. I can't think off the top of my head, but there's quite a few.
5 or 6.
Yeah, 5 or 6 to get around and get everybody, so make sure everyone has what they need.
So what are these, I guess?
This is your pill counter, and you would use it like you pour your supply into there.
You would use this right here, this piece, to pop open. There would be a film here that would keep it closed, and you would use that to pop it open. After that, we've learned to count in fives. You can count in however which way makes it easier for you, but you would get a script, a prescription, and then you would do what the doctor says. You would figure out the math and how many pills are needed for that prescription. And so we count in fives here. So we go 5, 5. So we're going to count out 15 here. So you get your 15. You take your excess that you don't need, you dump it back into the supply, and then you would take your prescription bottle, dump it in there. You would recount it after that, and then you would label it, and then you would send it off to the patient for their needs. And
Prescriptions go through multiple stages. So the doctor, if you're doing like e-scribing, it goes from a doctor's office to the pharmacy, and it is typed from the prescription, and then that prescription is sent to the pharmacist to check and make sure it's typed correctly. And then from there, it's sent to the printer, it's printed, and then the papers with the prescriptions on them are sent to fillers. The fillers fill them. Once it's filled, it goes back to the pharmacist, they check it, and once it's checked, it's ready to be sold.
Thank you, guys.
Thank you.
Can you guys introduce yourselves?
Hi, I'm Rachel Tanner.
Okay, I'm Maddie Barba.
I'm Emily Culver.
I'm Lillian Sanders.
Okay, can you tell me a little bit about your project?
Okay, so this is our phlebotomy project. On it, you can see where we've gone in detail about the history of phlebotomy and like how modern phlebotomy is right now. We also have like the methods of phlebotomy. So in our class, we learn a lot about venipunctures and how to take blood, which is phlebotomy. We also learn the different types of how to take blood and the test that you would use for the blood that you draw. We also talk about the laws, and in phlebotomy, in any healthcare setting, laws are really important because there is a lot of risks in healthcare. So you really want to know what laws you have to follow and what laws are important to your career and your job. We also talk about patient care and complications and emergency procedures, because in any healthcare setting, there is a really good chance of risk in hurting your patient, obviously, which you don't want to do, but there's always a chance of it. And so we learn how to deal with that and what steps we need to take to correct the matter.
You can pass it, and then if you would talk about them.
Okay, so these are 3D models. So this is just like a tube of blood that like hasn't been separated or anything. And then this is a tube of blood that's been centrifuged into the whole blood, the serum, and the plasma. So this is our little centrifuge. And what goes in it is just like the tube with the blood and then the additives on the bottom. And then it would spin really, really fast. And what would come out is the separated blood with the serum, the plasma, and the whole blood.
Okay. Thank you. Is that it, or is there? Okay, thank you.
This is a model of the exterior heart because we had to pick between like 5 different categories. So we had to use 5 different materials. So we ended up using this kind of felt and these weird materials. And then she let us use the stuffing as another material. These, we also had to have interactives. So we have little curtains.
Cute.
And they're kind of, you can also just flip them up if it's too much to push them to the side. And then this, we actually thought we could put leads, like actual leads and stuff, and let people take them off and place them where they go. Just in case nobody listens or can read. Yeah. Because like there's...
All right, see? I didn't listen or read. I want to tear up your poster.
No, it's fine. We super glued and hot glued all these on.
Oh.
But no, so we can let everybody, and then it looks like you're hooked up after they're all said and done. It looks like you're hooked up to the little EKG machine.
That's awesome.
Yep. Thank you.
So, are you gonna get your certification and work at the hospital?
My parents work at the hospital already. My dad's Kevin Nickerson, and
I love Kevin.
My stepmom is Bethany Nickerson. So
they fix everything for us.
So they're hoping to help me get a job there one day. That's
awesome.
It's funny that you know my dad.
It's a big hospital, but everybody knows everybody.
Yeah, yeah.
We actually take our certification next week.
Yeah.
Are you nervous? No, don't be nervous. Yes, this looks great.
Thank you.
Thank you.
All right, can you guys introduce yourselves?
I'm Samantha Ragsdale.
I'm Chelsea Menace.
Tinley Puckett.
All right, so tell me a little bit about your guys' project.
So our project is about what we have learned over the course of our EKG technician trimester. This is all the information we need to know to take the NHA exam, which it gets our certification in EKGs.
Can you tell me a little about your model and your project there?
Yes. So actually, we have underneath our curtains on this one, we have the history of EKGs. So this one over here is about like what happened in the old times about it, and then the one over there is about the modern today's time, and then we have how our EKG is actually set up. She actually explains that, so we're gonna switch really quick.
So with V1 and V2, you have V1 on the right side of your chest and V2 is on the left. You're gonna skip V3 for right now. You're gonna go to V4, which is your fifth intercostal space. And how we determine that is actually through your ribs. You're gonna go back up to V3 and place that between V2 and V4. V5 is your anterior axillary line, and V6 is your mid-axillary line. And then whenever you get to your limb leads, you're gonna place your electrodes on your wrist right here, and then in between your legs down at the bottom.
I'm so sorry.
It's okay.
Anyways, so this is our model. Our model is showing what we read as EKG text, how to explain what it is. These are actually interactive, so we actually have them off when someone comes over here and looks, and we put them back on. We have them put them on where they think they go. They are color-coded. The P wave is an electrical depolarization of the atrial of the heart. That is showing, with the string, is showing how the string is constricted. So that's what happens to your heart. Your heart is actually contracting in the P wave. The QRS is the impulses spreading through the ventricles. That's the QRS complex. And then the repolarization of the ventricles is the T wave, which when she releases the string, it shows the heart is relaxing. Typically, we do EKGs for when people have heart attacks. So we are reading where in the heart is happening, so we know how to fix it. So what treatment they need, if they need stents or if they need an angioplasty. I can't say that one. Can you say it? The angioplastia. Pretty much, we take a ventricle of the heart and it's burned away, so like it's no longer working, so they don't have a cardiac disorder. They might have a heart bypass surgery or a valve disease treatment or a pacemaker placed in their chest.
All right, can you guys introduce your guys yourselves?
I'm Chloe Frederick.
I'm Grace Maravella.
I'm Kaviana Ramirez.
Can you guys tell us a little bit about your guys' poster?
Yes, so starting off, we had a pharmacy class here at EC3, and we all had to do posters. So this is just an overview of it, and over here we have modern phlebotomy. It's basically job skills, professionalism, basically what to expect if you wanted to become a pharmacist. And there's also some agencies associated with it, like the Joint Commission, some certifications that you would need. And then over here are some laws, like there's the Pure Food and Drug Act. It like monitors all the medications and stuff like that. And then down here is the different type of pharmacy settings, like outpatient, and just the differences between those. And then over here is history of phlebotomy. So it goes deeper into it so you have a better understanding of it. And that's basically everything.
Sweet. Nice job, guys.
Please tell me your names.
Reagan Wells.
Isabella Riggs.
Taviana Ramirez.
Juliana Kiter.
Can you tell me a little bit about your project?
So we did phlebotomy, as you can see, and then we just have different aspects of phlebotomy. Over here we have the history and some facts and what phlebotomy is, which is the act of drawing blood either from a incision or a cut. And then over here is agencies associated with phlebotomy, some skills, some professionalism that comes with the job, and what you need to do to become a phlebotomist. Over here is some complications, like what can go wrong and what they are. So everything is client, and then over here is like chain of custody, HIPAA, which protects patient information, and informed consent, just legal issues with phlebotomy. And then this is our 3D model. We just did a hand showcasing the veins. And under these flaps that you see over here, we have some hidden facts. They're just interesting facts. And we also have this 3D model which showcases the order of draw, and people who couldn't come up are allowed to replicate it onto this.
So, what are some complications of drawing blood?
Some complications are hematomas, hemolysis. So hematomas is when you stick and it's basically a bad bruise when the blood gets out and it's surrounding the vein. So you can have nausea, people faint typically, and then you just have to lay them on their back. So stuff like that.
So, can you tell me a little bit about the order of draw and just what kind of goes with that?
So the order of draw is shown here again, but we have it, it's based on what test you need, and that's why we have it. So do you want to explain that a little bit?
So like different tubes go with different tests. So some tests you kind of draw blood differently. So say one tube, say you have a glucose test, which is the gray tube, which is the last one you would draw. So if you had different tests before that, you would draw those before the glucose.
Why does it matter so much to have a certain order?
Different tubes have different additives. So like in the tube, it had anticoagulants or coagulants. So they'll react with the blood differently. So you kind of want to draw certain ones before others.
What are some of the, hidden facts on your presentation?
For that one up here, if you do it, it says like the first president's death was due to a bad bloodletting procedure, which is phlebotomy. It used to be called bloodletting, so that's up there. This one, it just reads the total length of your veins and capillaries combined equals to about 60,000 miles. So it's just stuff like that.
Thank you guys for participating.
All right, thank you.
Hi, I'm Katie Skaggs. I'm a nurse educator at Baptist Health Hardin. I have been there for 11 years.
Hi, I'm Jenny. I am also a nurse educator at Baptist Health Hardin. I have been there 18, almost 19 years.
We got the pleasure of observing the nursing assistant program here at EC3, and I was very impressed with the skills that they had learned that I did not learn until I was in nursing school.
We also were able to attend their capstone fair that they had. And at that fair, the EC3 students had 3 different topics that they were discussing today: phlebotomy, EKG, as well as pharmacy. Each of them had a poster that they had worked on together, and we were able to go around and they could just tell us a little bit about their poster, what they liked about that topic, and we were able to ask questions. We were both very impressed with the students and the way they answered the questions. They had put a lot of hard work into those projects.
Very creative and beautiful posters.
Okay. Will you all introduce yourselves?
Jackson Abel.
Nevaeh Pointer.
Haley Bogan.
Kylie McCoy.
Okay, can you tell me a little bit about your project?
Sure. So, do I take it?
Sure.
Okay. EKG. About my project. What exactly do you want to know from it?
Tell me about your
Model.
Our model. So our model here, it represents a heartbeat of the EKG. You put the electrodes on someone, and you'll get these movements. On a strip like this one has no movement on it. They're asystole, that's what that's called, they're flatlined. But if they were alive and they had electropulses, it would look like this, and that's how you want it to look. That's a perfect wave. Everything is timed perfectly, and that's how it should look. That's why we did the model. We wanted to showcase it and show people how it looks. But yeah, here in the van, talk about it. Good facts.
Okay, so in order to have a normal rhythm, you should also be able to identify your P wave. Your P wave is where the heart is contracting and it represents depolarization. So as long as you're able to identify your P wave, you're on a great start. Now I'll go ahead and pass it here.
Oh, okay.
Ellie, I want you to demonstrate.
Demonstrate. Okay, so this is how oh my gosh. So this is how the EKG electrodes go on. So it goes, why don't I remember?
Right arm.
Oh yeah, right arm, left leg, left leg. This patient does not have arms or legs, therefore we have to put them on the body. And then you have V1, V2, V3 fell, or no, V2 fell, sorry. And then there's V3, V4, V5, and V6. They all go in different places, so they all have different views of the heart. So like V3 is like mid-clavicular line, fourth intercostal space, that just means in between the ribs. And then like V5, no, is this V4?
Yes, it's V4.
Oh, V4.
Yeah.
And then it just keeps going in a line essentially. So your patient has to stay still, no talking, no moving. It's best if you remove cell phones because that can cause like a mess up with the EKG. So like once all that is done, you have to make sure your patient doesn't have any chest hair. If they do, you need to trim it. You need to make sure you clean off the area with alcohol pads. And then it'll start, oh my gosh, I forgot it's touchscreen. It starts showing up on this machine. And usually there will be movement on here because usually your patient is alive. And then once it once it settles out, you just hit print. Why is it not working? It's making me look stupid. Thank you. And then it'll print itself. I know. And you're supposed to like enter like the date and everything and tell whether it's male or female because if you get that wrong, it can mess up the EKG strip. And then it'll print out just like this, except for they'll be alive.
As you can see, there are a large number of students who are successfully achieving their future goal of working in health sciences. It's a terrific pathway and one of our largest career pathways in the Hardin County Schools. If you'd like additional information about the health science pathway at EC3, then go online to the Early College and Career Center. It's part of the Hardin County Schools, and take a look at what the opportunities are available. Thank you for joining us on this edition.